Our guest speaker today is Dr. Raffy Luquis, an associate professor of health education in the School of Behavioral Sciences and Education at Penn State, Harrisburg. He earned his PhD in health science at the University of Arkansas and his MS in health education and his BS in life science at the Pennsylvania State University. Dr. Luquis has a very broad background in health education and health promotion. His primary teaching and research interests are cultural competency and multicultural health, health promotion, and human sexuality. He is the co-editor of the Cultural Competence in Health Education and Health Promotion textbook, a premier book in the health education field. So, welcome, Dr. Luquis.
Thank you, Dr. Walter. It's an honor to be part of this presentation and having the time to talk to you and some of your colleagues and students. So I really appreciate your invitation for this, to share some of my thoughts about cultural competency moving forward. But I wanted to always go back and start with some of the basic definition that we use and why do we need to do cultural competency? Cultural competence in health education, why is that important? As you know, cultural competence and humility, have been associated with health disparities. It's some of the things that we do to make sure that we eliminate health disparities or reduce health disparities, hopefully improve health equity, and as we work with diverse populations. So it's something we have done for the last 20 plus years now. It's nothing new to the field, especially health education, public health. Some of these terms go all the way back to the 1990s, even a little earlier than that. So something that we've been working in the profession for a long, long, long time. I started working on this early in my career, probably in the late 1990s. And, as Dr. Walter said, the first time that we did some articles that I published in this area was in the early 2000 and later on in 2008. That was the first time our book on culture and competency in health education, health promotion came about, because I thought that was really important to discuss the issues. And it was really important at the time for my students on my program to understand what this means, understand how this impact who we do, what we do as a health professionals, and impact our work with different diverse groups. The other thing, if you have, some of you might be familiar with the most recent health education, especially practice analysis project that just got published a couple of years ago by the National Credential Association for Health Education Specialists, NCHEC. And one of the things in that document that was clear for us to keep working on this area is there was a need to apply the concept of cultural competence and cultural humility in several of the sub-competencies of the revised responsibilities for the profession. So once again, we're making an emphasis that this continue to be an important part of our own competencies in the field, an important part of who we are when it comes to professionals working with diverse groups. Now, by definition, this is just one definition that our field have used for many years, and I want to provide some of these definitions to have some sense of what we are. Cultural competencies have been defined as that developmental process, a set of the values, principles, behaviors, attitudes, and policies that enable health professionals to work effectively across racial, ethnic, and linguistic diverse population. This was a definition. There's a lot of different definitions out there, but this was the definition that the Joint Committee on Health Education and Promotion Terminology came up in 2012. And I believe that this particular committee is going through some revisions right now, and they will probably be publishing a new terminology handbook, and hopefully cultural competency, cultural humility, all of that will be back in there. Now, one of the things about this definition that was interesting at the time and is still today is that this did involve more than just the individual. Let's talk about the developmental process. When we talk about added policies, we're thinking about policies that deal with the work environment, policies that the health policies that relate to cultural competence. When it comes to work policies, whether your own work setting have a specific policies to encourage and to support cultural competency. So it's more than just the individual. Now, within that concept, if we have those principles, policies in place, then the health professional will be more able or better able to work effectively with diverse populations. Now, cultural humility, on the other hand, is a little bit different. It's the idea of this process of an openness and self-awareness and being egoless and incorporating a self-reflection and critique after willingly interacting with the other population. So one of the things about cultural humility is that's important to understand is this idea that we need to be open-minded. And I think many times one of the things in the profession that I encounter when working with my students or working with some of the professionals, the idea that some people might not be there yet. They know they need to work with different groups. They know they need to work with diverse individuals, yet they might not be so quite open-minded about how do I go about doing that. So this part of open-mindedness related to this awareness, your own awareness, you being egoless, being humble yourself to the idea that I'm humble in a way as I work with others, I might not know everything I need to know when interacting with diverse individuals. Now, one of the things that I want to introduce to you, and some of you might have seen this, some of you, this might be a brand new term, is the idea of cultural intelligence. And this is a term that I came through a couple of years ago. And this, by definition, this was also a term that was a bit early on back in 2002, but early and some of his colleagues. And this talk about this is, by definition, is representing individuals' capability to adjust to cultural situation based on a multiple aspect, including cognitive, motivational, and behavioral characteristics. Now, cultural intelligence initially came from the business arena and from the global environment. As we work with a lot of people across the globe, we need to become more culturally intelligent. One of the things about cultural intelligence is that this relates to the same intelligence research area, like you talk about IQ, we talk about social intelligence, we talk about emotional intelligence. So cultural intelligence is adding to that spectrum of this different type of intelligence that we should develop, but this coming from a cultural point of view. One of the things about cultural intelligence that have 4 specific areas to look at. Look at cultural knowledge or the cognition that we have to go through. So it's more than just be aware of something. We need to go through the process of understanding or learning about the different culture and the different cultural situation that we might encounter and how we respond to those. Also talk about cultural strategies in the idea, and this is what they define a metacognition. And we have to look at, you have to almost prepare ahead of time when you go someplace and think about what will be the different strategies that I will put in place when it comes to interacting with other people. What kind of things can I see? And it doesn't mean that you have to adapt, it's not just one country specific, it's not one culture group specific, but it's something that you can adapt to it as you see different situations happening. They also have what they call the CQ or the cultural intelligence drive, which is similar to what I've seen when we talk about cultural competency and cultural humility, in the idea that sometimes we have to have this motivation, but it's more than just a desire. Sometimes in cultural competency, there's some theories that talk about this cultural desire, cultural awareness, but in this case, this CQ drive is a motivation, internal motivation. You're really motivated, how well you are motivated to work with other people in kind of the situation. And finally, this cultural intelligence talk about CQ actions. What are the actions that you're taking, we're working on? What are the behaviors that you work on? And that's something that we have to learn as we observe other people's behavior. Think about, put yourself in a situation where you might go to a different country, you go to a different community, you go to a different area in which a place that have diverse population you're not familiar with. Maybe one of the first things you have to do through cultural intelligence is the idea that we will learn before you get there, learn about that culture, learn about that group, and understand what some of the cultural values are, some of the cultural behaviors are, and so on. When you get there, then you start looking at strategies. How do I incorporate myself there? Do I shake somebody's hands? Maybe not, because that's not acceptable in that culture. How do I do a greeting? How do I go about talking to people? How do I about interacting with people? What kind of things people do when it comes to interacting with others within that cultural context? Think about then the drive. What is my motivation to be there? Is it just because it's part of my job that I have to be there? Or it's more a really internal motivation for me to be there because I really want to learn. I really want to do the best I can to make sure that I have a great interaction with that diverse group. And finally, what are the behaviors that I have in place? How I'm going to behave in that situation? How would I want to interact with them? I want to make sure that I don't just copy behaviors that I see, but understand why these people behave that way within that cultural context, and me coming from the outside, how would I behave in that sense of it? So what is the difference? People say, what's the difference? Cultural competence, cultural humility, cultural intelligence, all sound the same. People think it's the same. Well, one of the arguments is being that cultural competence is the first thing we see out there. In fact, that's what I have pretty much preached for many years now, for almost 20 plus years now. I've been emphasizing all about cultural competence. The idea that we develop this process in which we become better able to work with different people. Some people at Danso in 2018, and even Kapina Bakar in 2018, argue that in fact cultural humility is already part of cultural competence. Because as you humble yourself, as you go through this process of understanding and working with other people, you're already going through that process of, growing, if you will. That process of developing your own cultural competency, and cultural humility is part of that process. So they even said that, it's incorporated. Cultural humility is already incorporated in cultural competence. In fact, Kapina Bakari she came up with a new term. She called this the compatibility. Basically, the idea that is almost like a synergy between cultural competence and cultural humility. So they're really almost together. They complement each other. They're part of each other. So there's no separation. Now, you will also have some people who will argue, no, that's not the case. Cultural competence is more about a developmental process that might have to do with organization and so on. Cultural humility is more about the individual process and how they go through, become humble to work with other people. Then cultural intelligence, it does have a little bit of both. Cultural intelligence, as we see, does have this idea that we need to be aware, but we also have to acquire knowledge, which you will have to do with cultural competence. In cultural intelligence, you also have this cultural motivation. You have to be motivated. You have to have this, it's more than just a desire of it. And then you part of the process, part of the develop strategies and part of develop your behaviors, you almost have to also humble yourself to understand the things you don't understand as you go through that. So cultural intelligence brought you a little bit of different perspective because it's coming to the intelligence research out there. So just, I just want to put this out there. Somebody asked me, so which one you prefer? I still go with the cultural competence. In the last, right now I have a manuscript that is out there in the review that I'm talking about cultural intelligence. How do we start looking at cultural intelligence and incorporating some of that into health education, health promotion, which is being used in the medical field, is being used in the business field, is being used even in nursing field, but we haven't quite grabbed the whole idea of cultural intelligence within health education, health promotion. So I'm still out there. So once that, so that's what I'm sitting right now when it comes to all these different terms, terminology, if you will. Now, one of the other things that I wanted to then talk about is, as we talk about cultural competency as a whole, as that's the main thing that I've been working on, what are just some of the strategies that we can do as health professionals? And again, some of you might have seen some of this before, some of you might already be doing some of this in your own professional field, or as you prepare to become a professional in the field of health education, health promotion. Number one, you must recognize the importance of culture and respect diversity. A lot of people say, well, in the past, there was this myth, if you will, that people say, well, only culture groups are those people that we talk about African American, or we talk about Hispanic, or we talk about American Indian, Alaska Native, or we talk about Asian or Pacific Islanders. They have a culture. What about the white people? They have culture too. Is the American culture is part of mostly from the white, European centric kind of culture. So we have, culture is about everybody have their own values, belief systems, and attitudes, and so on, and behaviors related to the culture. And many of you know that culture influences everything we do when it comes to our health behaviors, when it comes to what we eat, what we do, how we behave. All of that is related to our culture. So we need to recognize that culture is important. No matter where you are, where you're sitting from, that's importance about culture. An idea that then you respect diversity. People are different from you, and even within the same culture. I will say, just for example, I'm come from the Latino culture. So within the Latino culture, there's hundreds of different countries out there. We share a lot of commonalities, but there's some differences within whether you're in Mexico, or you're talking about Puerto Rico, or you're talking about Brazil, which is the Latino country yet, but Brazil, because they speak Portuguese, might be a little bit different in the cultural views. So again, we have to respect that diversity with the different cultural settings. The other thing that I've always been proponent of is the idea that we need to understand where we live at. What is the cultural profile of your community? Think about where you're now. If you're in Iowa, I'm in Pennsylvania, I'm in central Pennsylvania. For example, in our cultural composition of my community, there's a lot of Hispanic community who have moved to the area over the years. But yet the percentage of Hispanic community in my area is smaller than if I go to Philadelphia, for example, or if I go to the Lehigh Valley, which is the east part of the States. But also in my community, I have a lot of African American, I have a lot of refugees, we have a lot of other Asian communities. And again, mostly we still have white, non-Hispanic members of the community. So I need to understand the profile. What else is the profile of the community? We need to understand language spoke by the different groups in my community. I need to understand the religious belief that this group in my community. I need to understand some of the other things, many times I need to understand what else is out there when it comes to their food they might eat, the things that they do, maybe the celebration they have, and so on. So understand that profile, understand who your cultural community is, so you are better able to then serve them when it comes to health promotion and health education. Then part of that is also making those connections, making the connection between culture, again, understanding that culture is important, and then understanding that social determinant of health, which is another topic that some of you would be familiar with, is the idea that whether it's employment, education, income, the social status that you are within the community, when it comes to, whether, the early life, what kind of things in early life have you gone through and so on. All of those impact health. Those are the social determinant of health. Culture is part of that process. One person might be from a different culture. The way they were raised, that they were living on is a lot different than the way that, that you and I might be in there. For example, I used to tell my students, if you want to understand the people in your community, we talk about social determinant of health, go to the community. If I go to, for example, I'm in the suburbs of Hattiesburg area, but if I go to the inner city Hattiesburg area, it's a whole different social determinant of health. In that area, I will see that when it comes to a grocery, for example, there's only one grocery store that really serves that community. Most of the stores are maybe, corner stores. Well, we know from social determinant of health that that's not the best resources they might have when it comes to getting good food and produce and so on, to have healthy eating. That's not appropriate. So that doesn't have to count. Now, if I live in my area, we have probably 3 or 4 different grocery stores within the same radio. So it's a whole different situation. So I need to understand that and how that connects to cultural competency, how that connects to health. The other thing that we'll be looking at more and more now, because we have gone for the last few years now, is the idea of racism. We definitely understand how race impact health and racism and impact how people perceive health and how they go through some of the determinant of health. Right now, one of the biggest examples that we can give you is, we've probably seen that all over the place. COVID-19 pandemic and how racism have almost highlighted the idea that because, some of this group, African American, for example, and Hispanic, Latinos, for example, the two main groups have been more affected by COVID-19. One of the issues we have really understand how racism plays an important factor in there. The idea that because some of them didn't have access to healthcare, or maybe there was some bias in the access to healthcare because of racism, they didn't get the proper information initially to make sure that we're prepared to prevent COVID-19 infection. And we have seen how these two cultural groups, or these two ethnic racial groups, have been more affected by COVID-19 than some of the other groups. And finally, how the health problems are related to a lot of the risk behaviors. So culture influences how you engage in your behaviors. Health is related to your risk behavior. Some people might engage in higher risk behavior because who they are culturally, because it might be acceptable in the culture. For example, some people say, well, how come some groups are more obese than others? Obesity is a rampant, it's a health disparity of obesity is out there. Well, some groups, for example, eating is part of their culture, and you might consider that to be a risk behavior. They're engaged in that risk behavior because the kind of food they eat, the amount of food they eat, and so on. Yet it's part of the culture. So we have to, once again, make those connections. It's not just saying, well, it's just health and this is what it is. It's nothing else. Just physical health is the only thing connected here. Culture, social determinant, racism, all that connect to each other. So we need to understand that. And I'm sure many of you are already aware of the situation. The other thing is, when we talk about one of the main things we do in health education, health promotions, plan, implement, and evaluate health interventions. So first of all, whichever community you're working with, the first thing we need to look at is assessing the capacity. Every single community has a capacity for change. I've been working in some of the community agencies in the area, and yet everybody's at the capacity for change. So sometimes we dismiss that. We think, well, they don't change, they don't want to change, they don't never change, it's always the same, and so on. They do have the capacity, but the idea is for us to sit down with them and involve them in that process, involve that community in the process in order to understand where they're coming from and what resources they might need for them to make that change. Also, when we do any type of assessment, we need to have those appropriate tools to measure outcomes. Depending, again, let's see, we're talking about some intervention that talk about eating behaviors. Well, depending what kind of community you're working with, the eating behaviors or patterns of that community are going to be different than the eating behaviors of your own community. Therefore, the tool that we measure, the outcome is going to be different. Just a quick example, many years ago at the 10-year conference, somebody was talking about the eating behaviors of Asian American. And they said, well, it doesn't seem that they're properly having a nutritional intake or so on. Well, why not? Because the tool that they were using wasn't measuring the type of eating, practice that they have. It wasn't measuring the type of food that they were eating, and therefore it was becoming short. When they adjust the tool to measure the type of food they were eating, they realized these people are probably eating much better than we thought to begin with. So sometimes we have to look at the proper tools that we use. Same thing when it comes to language. What tool are we using? Are we using a tool that is translated properly to the language of the community that we're working with, and it's so they can understand, and then you can gather information that you need for your program? So that's a key. Also, think about education. Some people in some cultures, education is not there. Many of them, especially migrants, might come from an educational level that's only high school or less than high school. And even though it doesn't mean that they don't value education, it means that because whatever situation they were at in their country, and as they move to the United States, they might not be able, they have not ever been able to achieve that educational level that we will see in some of the other groups. And so we have to consider where they're coming from, what education level they have. Cultural protocols, what are those? Think about how people behave, how people react. If you have people, for example, that come to your interaction and you say, well, the protocol, the culture, they have to be family oriented. They have to be more interdependent. So therefore, part of the protocol is if they come to you, they're going to be all of them. Just an example, I was doing a study a couple of years ago on Latino men. I went to interview a man as part of my research that I was doing, and everybody was there. The whole family was there. And, if you think about it, I couldn't do that interview because IRB say you have to have confidentiality. You have some, we have to follow the research protocol. And yet the family was there. They didn't seem to care whether or not they were going to stay in the same room as I was doing the interview. So I needed to say, well, sorry, I cannot do the interview. I need to be in a separate room with the person I was interviewing in order to still maintain the research, but yet understanding that the cultural protocol entailed that they were fine. It was part of the family. So whatever that person said, it was okay to say it in front of the family members. So sometimes we need to understand those kind of things. Acculturation is one of the things that we also have to continue to understand. Just because somebody's been here for many years doesn't mean that they're completely acculturated. They still maintain a lot of their own culture, and therefore is the difference between the different generations. You might be a second or third generation and still be completely still attached to the initial culture that where they come from, versus somebody who's been here a longer time and now is more acculturated to the American culture, to the mainstream culture. And definitely, finally, we have to start talking about health literacy and languages. Just because, first, linguistic competency is one thing sometimes we forget. What is the language of the community? How much do we know about that language? Do we able to translate things to the proper language and the proper context of that language? User interpretation might not be enough. What else do we need to do about it? And even if the language is not much of a barrier, then it comes to health literacy. Do they really understand some of the health information that we are providing them within their own educational level, within their own literacy level? If not, then we have to lower our level of information for them to understand it. We might need to educate them about health in a way for them to understand the information that we're providing them. So part of the health literacy also have to be assessed. And finally, like every single thing I always say over and over again, and people sometimes forget this, the idea that we must always involve cultural brokers and leaders and include that community. Right now, I'm planning to do another intervention. I'm working on, again, working with Latino men and in colorectal cancer. And I'm working through some of the churches. I'm working with some of the leaders of the church. I need to involve the priests. I need to involve some of the community leaders. And I'm from that community. And yet, because I'm coming from the outside in a way, because I'm only working only in my community, but I'm only working in 3 other counties, I need to go to those counties and connect to those brokers, connect to those leaders and say, please help me in so I can then come to your community and work with you. So just because you might be part of the culture doesn't mean you can easily go in there and do what you think is best for them. You still have to work through these brokers, leaders, and so on to make sure that you do a better job when it comes to working with the people, doing the best things for them. So that's something to keep in mind. Now, individually, one of the things I wanted to then, if nothing else, wanted to take away from this is the idea that we all have our own journey. I've been doing this for over 20 years, and people said, "Are you culturally competent?" I will say, "No, I'm not. I'm still learning." Why did I say that? Because the more I learn, the more I realize sometimes things change, culture change, group change a little bit. Culture is always changing, and therefore we have to continue through this journey when it comes to cultural competency. So when it comes to you, when it comes to me, the same thing I would say to people: learn culture, but be aware of, start with your own culture, who you are. What is your cultural background? What do you value? What are your belief systems? What things, who you are, and importance of that before you move to something else. One of the things that I used to say many times to my students with the idea we all have our own cultural baggages. Where it's like suitcase. You carry your own culture with you every place you go. But you need to understand that. And how could that culture have changed? When I came to the United States over almost 35 years ago, I came with my own cultural baggage, being from Puerto Rico. And yet when I came to the States, I thought, well, I'm from Puerto Rico, so I should understand what other Puerto Rican people feel like. I didn't, because the Puerto Rican people who live in the States, were born in the state and live in the state, or have lived in the state for many more years than me, the cultural content was a lot different from mine. So I needed to understand my own culture before understanding their own culture. The next step is always develop that cultural awareness. Be aware of what you don't know. Be aware of what you know, and then have that desire to learn from other people. I made my own mistake over the years. Sometimes I make assumptions about what I think I know from other cultures, but I still have that desire to learn. So I have to ask questions sometimes. I have to ask, go through that process of aware that even if it's another Latino person, it's different from me. If it's an African American person, which I have encountered before, might be a little bit different from me, and so on. We always have to honor and respect other culture. I think sometimes we live in a society that have this ethnocentric view sometimes in some part of the country that talk about, well, this is America, so we should honor the white culture. That's it, nothing else. We should honor America. We should all be the same. And it's not the case. Right now, you see how people are mistreating the Asian community because of the COVID-19 idea of that make it into, the Chinese virus have become the enemy, and therefore we should impact how Asian Americans are being impacted by the situation. And yet we need to sit back and say, no, we need to respect them. It's not their fault that we got a COVID-19 situation, that's a pandemic. They have nothing to do with that. We need to respect the culture. We need to respect who they are. We need to honor who they are, just as we honor who we are, and we respect our own culture. And then that way we minimize some of the things that they're going through. Hopefully that help minimize some of the disparities that we're going through, and some of the violent attack against some of these communities that are completely horrendous right now. And because of that journey, we then have to accept that there are differences. People are going to be different from me. Just because I value something doesn't mean that somebody will value the same way as I am. I remember doing a presentation many years ago about sexuality and the Latino community. And one of the concept that I put in place was the idea of family, and how family was a big value within the Latino community, and therefore impacted some of the sexual behaviors of adolescents and so on. Well, somebody came to me afterwards and they said, well, what you making this big about thing family about the Latino community? I'm not Latino, I'm white. My family is important to me too. And I said, well, I never said that your family wasn't important. What I'm saying is within the Latino community, there's a family was important in the context of what I was doing a presentation on it. So we did understand that, yeah, there's some difference, but we also have some commonalities. And, in some situations, some people say, yeah, family is important. There are differences. For some people live in multi-generational families because that's important for them. You will see that as that's a little bit weird. Why they're all grandma and grandpa and everybody else living together? My family don't do that. So again, we need to understand that and accept those are different. Another thing you can do is, value diversity. Think about the people you have around you in your community, with your peers. Go out there, enjoy cultural events. Go and enjoy going to a cultural restaurant, different places, and start valuing that diversity you might see in your community. If you haven't done so, why not? Take a chance, go out there and do that. The more you go out there, the more you do that, the better you will be, the more you learn about it, the more you become aware of some of these cultural differences and some of the things that we have to go through. Another point that I want to make is part of this journey, we also have to acknowledge the importance of trust and sensitivity. As I work with a lot of different people over the years, and I tell my students to where the people is, as I just mentioned earlier, just because I'm a Latino person doesn't mean that I can go to a Latino community and they're going to trust me right away. I need to be sensitive to the idea that they don't know me. The other thing is I'm a professional. I belong to the Penn State University. So they might see that as somebody they don't want to trust on it because they might have some issues before when working with other people from the institution that I represent. So I need to acknowledge that in order for them to trust me, I need to trust them first. And I also have to be sensitive to their needs. And we have to develop that trust relationship, with everybody that we work with. How can we develop that? We might have to sit down. It might take time. It might take patience. It might take time for us to sit down and talk to them about it. What can I do so you can earn my trust? What should I do in order for me to make sure that we can be in the same level when it comes to trust and sensitivity? The idea that sometimes, definitely they won't trust you. Right now, once again, one of the biggest issues that we see right now is the idea that some people are saying, I'm not going to get vaccinated with COVID-19 vaccination because I don't trust where it's coming from. And that's happening in the Latino community, and it's happening in the African American community. Think about the African American community, even though it had been over almost, 100 years later, the syphilis study that happened within the 1930s to the 1970s, that created a big mistrust in the African American community when it comes to the healthcare system, when it came to working with medical professionals. That trust was also challenged when it came to HIV/AIDS epidemic that we had back in the 1980s, 1990s. Once again, people say, here we go again, giving us something to our community to kill us. So why would I think that, so we see that again today, people are going to mistrust something coming from the government, something coming from a medical facility that they still have some trust issues with. So right now, for example, in Pennsylvania, one of the things they finally decided to do, which I was waiting, why they waited so long to do this, they decided to involve people from the clergy, pastors from the communities, community leaders from those different communities to come out on TV and come out on the different type of venues and start talking about why it's so important for people to get vaccinated for COVID-19. Even to don't be afraid of the vaccination, to learn to teach people about what it is and what it entails. That, again, is building the importance of that trust. If we don't understand that, we won't be able to do some of the job we have to do. And professionally, if I don't develop that trust with people, I can't do anything. So that's part of that journey. There's going to be a lot of differences, and there's going to be conflict. I think one of the things right now that I failed myself in the last few years, this idea that, we're going through these conflicts in society, conflict about who's right or who's wrong. People say, well, Black lives matter. So people say, well, why Black lives matter? Shouldn't all the life matters? That's part of that conflict. That's part of going through that journey. What does it mean when people say Black life matters? And you say, well, I disagree with that because I'm not Black, but my life matter too. I think people right now also say, some of the conservative areas saying, well, Black life matters. So I'm going to use the same logo and say, well, baby life matters. So we're talking about the issue of abortion. That's part of that dynamics. That's part of that power of conflict. People come from different points of view. And you might find yourself in a situation that you disagree with some of this conflict. You disagree with the people coming from the right or the left, in the middle, whichever part of their country, whatever political agenda they have, whatever social agenda they have, whatever situation they might come from culturally. Now they're talking about cultural appropriation. That's one issue that happened a few years ago. People now they're talking about cancel culture. That's another thing that's happening now. So that's part of that conflict. How do we manage that? I don't have an easy answer other than sometimes you have to sit down and going back to the beginning of it. Okay, where are you sitting from? Who is your culture? Who is you coming from? Who you are? And then thinking about, what does it mean to you when it comes to that, some of that conflict? And maybe we need to appreciate some of that power of conflict because then we understand how things might be changing. One of the things we need to know, and if you haven't realized by now, is diversities continue to happen in the United States. By the year 2050, by the year 2060, white America is going to be smaller proportionally to the population than some of the other groups. They might be down to like 50%. Right now, white non-Hispanic population is still around, 80% or so, sometimes, 75, 80%. Well, it's going to be down to like 50%, another 40, not even 40 years, another, around 40 years from now. So those are changing, diversity is changing, demographics are changing. We will see some of these different dynamics playing in front of you. And some people say, well, I live in, in your case, you might say, well, I live in Iowa. Why would I care? I don't plan to move. The people around me look like me, act like me, and so forth. Well, what if you move? What if more people and then start moving into your own community who are diverse? I remember visiting many years ago. I went to Maine to do a talk, and there somebody said, "Well, it's like 95% white." So when it came to diversity, they didn't seem to have too much of an issue. And yet, over the past few years, they have an influx of migrants, refugees, people from African countries, people from some other areas. So that's happening. So that's changing. So there's some dynamic changes there. So they need to go through that process. That's part of their journey. Then again, how we adapt to some of this, we have to commit ourselves to continue to learn. As I said, I keep learning. I keep trying to learn. If I don't know the answer, I learn. If I do something wrong, I try to learn. It doesn't mean because somebody's different from me, they're wrong. It just means that they're different. So I need to learn that. I need to ask questions. I need to learn. I need to talk to people. I need to find books. I need to read whatever that might be. I need to continue my learning process in order to make sure that I'm adapting to some of this diversity. And I know that we have another 20 minutes or so, but I want to leave some minutes at the end for questions. Two more things I wanted to leave in place as part of this journey. Once again, you have to make that commitment. What is cultural competency, cultural humility, or cultural intelligence? Whatever the commitment you're making as you move in your journey. Make that commitment. What do I want to do? It's more than just a desire. It's more than a motivation. You have to make a commitment to it. I want to be more competent in this area. I want to be humble when it comes to working with other groups. And I want to develop some kind of intelligence and strategies and skills and cognition and motivations and all of that in order to be a better professional when working with people who look different from me. If I don't do so, then I'm failing in who I am or what I do. Because in a health education field, we work with a lot of different people. We work with diverse communities. And we're going to continue to do that. And we always want the best for it. If most of you have, you're just like, if you're like me, you will agree that we are in this field because we care for people. We want to help people. So in order to do that, we need to make sure that we are understanding when it comes to race, ethnicity, culture, and so on. And finally, when in doubt, don't assume anything. Ask questions. Ask questions. Why is this the case? I have many years ago a situation in which an older, returning adult students was coming to my office to talk to me about, joining the program in the health education master's degree program. And first, she was running late. So I was like, well, that seemed a little bit, disrespectful. I've been waiting here for this person for a while, and they told me it was going to be there 2:00, and it's now 2:30. She's not there. What's going on? So I made the assumption this person might not care, whatever, it's late, maybe it's not coming, whatever the situation might be. And yet, finally, she showed up, and she brought her husband with her. And again, why would you bring your husband with you? You're the student. He has nothing to do with what you're here for. But here's the catch. She was a woman from the Middle East. Something that I completely, I didn't know at the time until I saw her, because I only saw the name, but I didn't know much about this person. It was the first time I was encountering this person. Some of the assumptions I made. She's late. She doesn't care about, my time. I'm waiting here for her. Why would then she show up late, and then she showed up with the husband? Why she was late? Because she was waiting for the husband to be able for him to come with her. Why they came together? Because that was part of the cultural understanding. That they both will come together for this meeting. Again, you ask questions. Don't make assumptions. Ask questions. Try to understand. And and again, as I said, I have done my own mistakes. I've made my own mistake when it comes to this journey of cultural competency, or when it comes to develop this cultural understanding. But I've always tried to learn from it. Once I learned about it, once I understood where this person was coming from, then I was able to better serve her. Sit down and talk to her about what she wanted to get out of the program and so on. And she was one of the best students that we had in the program, through that time. So again, sometime when in doubt, don't make assumptions, ask questions. Don't say, well, they look like another Latino person I met before. They should do this way or that way. No, I don't. Right now, one of the biggest things I tell people is there's so many terminologies. One of the big things that people get to me right now, which is really getting on my nerves sometimes, is this idea of Latinx. Well, you should be a Latinx. And I said, well, I'm not. Why not? Well, because I'm not quite there yet. That's a term that just have been developed in the last few years. So that I don't understand the term, and I understand what it was developed for. I understand they have to do with gender identity, gender inclusion, and so on. I completely understand that, and I support that. However, when you ask the Latino community, do you know what Latinx is? They don't. Most of them don't know about it. Did you ask them, do they use that term? Most of them don't use that term. And therefore, when somebody comes to me and say, you need to then be considered this name, this new term, you are one of this now. Well, no, I'm not. But on the other hand, I said to them, if you talk to somebody who's Latino descent and they want to be considered Latinx, go for it. You can ask the question, what term would you prefer to be called? And if they say, I want to be a Latinx, then you ask them, fine, you use that term. But don't assume that because you use that term with somebody else, you're going to use it with me, because I'm not there yet. I don't quite fit within that term. Just like many years ago, I wrote an article that I, was published back in early mid-2000 or so on, about the idea of terminology when it comes to different racial ethnic groups. Some people said to me, well, you're a person of color. And I said, well, time out, what does that mean? Consider that to be myself, and I understand what it is. And now people are saying, well, now the black and brown people. Again, what does black, brown people mean? Again, those are terminologies that we're using when we're referring to different cultural, racial, ethnic groups, and yet we have to be careful to make assumptions that everybody agree with those terminology. Everybody seems to understand that, and everybody on the same page. No, it's better to ask the question. I said to people, fine. You want a color associated with who I am, my skin tone? Well, in the winter, I'll kind of lose my tan, so I guess I'm white. And in the summer, when I gain my tan back, I guess I'm brown. But it doesn't define who I am, so don't call me by a color of my skin. Call me for who I am. That's why we become competent. Ask the question, how do you want to be called? How do you want to be identified when it comes to cultural, race, and ethnicity? And then go from there. So I'm just going to end there. One of the things, again, This is the book that just came out. I just shared this with Dr. Walter, so I think she's going to be using her classes for next semester. This is our new 2020 edition of the third edition of the Culture, Competence, Health Education, Health Promotion book. Both Dr. Perez and I became the co-editors of this book. This past time around, I took a little lead on the editing section of the book. So, that's how my name is added in the front rather than in the back end of it. So now I think we have another 15 or so minutes on the stand. So if anybody have any questions, feel free to ask.
Okay, well, thank you so much for, oops, I'm getting some background, sorry.
I'll see if this helps. Get rid of some of that background. One question that I did have, and if you do have some questions, feel free to put those in the chat or feel free just to unmute yourselves and ask that question. But one thing, and it kind of goes back to a few slides ago, you were talking about how to obtain like a cultural profile within your community. Granted, the US Census information isn't available yet. So how do we go about doing that in order to better serve our communities? Is a community health needs assessment the appropriate way, or how do we develop or start developing that profile so we can treat individuals in the community better and more effectively?
I think that, a simple way the first step to do a community profile, and I know the Census 2020 just got completed and might still not be out there yet, but you can do some of the estimates based on the census data, and that provide a first step approach, just the first step, because that gives you some basic demographic. Who are they in the community, how many people they have, the percentage, so forth and so on, language spoken, the kind of job they might be engaged on, maybe the family composition. You get some of that profile. But then the second part of it is then, go out and talk to the community leaders, reach out to the people who live in that community and start saying, okay, here's what I learned from it. If you're doing a community assessment, that will be part of that. In many places, for example, one of the things that we have right now, I'm also part of the Penn State Cancer Institute. What they did many years ago was that they said, we want to understand more about the Latino community. So they created a Latino Hispanity Community Advisory Group. So there's a group of us who come together with professionals at the Cancer Institute, and when they talk about doing activities, doing interventions, engaging the Latino community, they sit down for us first and say, okay, here's what we plan to do with this work or not work in the community. And we have people represent, and the Penn State Cancer Institute represent around 20, 30 different counties. So we have in our advisory board, we have people representing probably 4 or 5 counties that have a lot of the Latino community, the majority of the Latino community. So sometimes you have to reach out to those kind of advisory groups, some kind of community groups, and say, okay, here's what I learned from some of the demographics, but what else do I need to know? What else do I need to understand from this community?
Well, thank you for that information. Any other questions from our participants? No? Okay, well, Dr. Luquis, I just want to thank you so much for taking the time out of your day today to speak with all of us. And everyone, have a great rest of the day.